I believe that the previous presenters have made my work very easy because most of the key areas that we discussed have already been said. So I would reduce my time. The next slide, please. Yeah, we'll look at the outline in terms of the main topics on the regulatory reliance. Look at the background, definitions, and the impacts that the practice will make on access to medical products, the perspective within the region, which is ECOWAS, under the West African Medicine Regulatory Harmonization, the benefits of the reliance, recommendations, and conclusions. Next slide, please. Now, what is the background of the initiation of the reliance systems of practice globally, and then, of course, the benefits to us in Africa? So the primary purpose of the good reliance practices is to promote a more efficient approach to regulation, improving and expediting access to quality assured, effective, and safe medical products with value-added regulatory capacity. In as much as we are assessing, we build our capacity as the regulators within the sub-region as well. And then the need of patients in demand for medicines development. As disease and pandemics and other conditions increases, it also calls for increase in medicines. For regulatory agencies to facilitate reviews and approvals and simplified procedures and reduce review timelines and backlogs. This also helps the progress in the processes that has been limited to developed agencies. But then if you look at it, you realize that for developed agencies, the process also flows over to developing and emerging markets as well. Next slide. Next slide, please. Please, can I be heard? Mara, am I heard? Next slide, please. Looks like we're stuck.
It's all right. We can hear you, and we've moved on to slide. The slide says, "What is the impact of the practice on access to the medical products?"
Yeah, it's not moving. The slides are not moving.
Do you need to go to the next slide?
Yes, thank you.
Please go to the next slide, production. Thank you. Do you need to move to another slide?
Yeah.
Okay. Move.
There was a slide before. There was a slide before this.
Okay. So page 5.
Yeah.
Okay. All right. Let's just slow down the movement of the presentation. It might be her internet on that side. Maybe she's not seeing it move. Dr. Sybil, can you hear me?
Yeah, I want to see slide 4. It's jumped about 3 slides. I want to see slide 4,
so definitions.
5, and 6. Yeah. So that is where it's supposed to be. Thank you.
Okay, perfect. Okay.
So when we looked at the presentations given by Madam Asma Khalil, it's about the same thing where the WHO as well as the International Federation of Pharmaceutical Association have defined regulatory reliance, which provides an opportunity for more efficiently utilize available capacity within the NMRs. So it looks I will not dwell too much on this slide because it's already been defined and spoken about. Slide 5, please. If you can all see slide 5, I don't see it, but then it talks about the impact of the reliance practice on access to medical products. Here it looks at the thank you. It looks at the opportunities that are given to all stakeholders and the impact on them. So where we look at the stakeholders as being the patients and the healthcare workers, which is the providers, in terms of timely access to safe, effective, and quality medical products, and also the benefits, all the impact on the national regulatory authorities themselves, where it also looks at the efficient utilization of resources by avoiding duplication of work and providing opportunities to strengthen the regulatory system while maintaining sovereignty over decision making. The reliance doesn't take their sovereignty from them. It's also see to the benefit of the industry, streamlined management of regulatory submissions and global supply systems, as well as predictable and timely approval. Realize that most, especially within our sub-region, we find that some dossiers could take about 2 years or more before the approval. But Reliance gives the opportunity to expedite that process. And if you look at the WHO Drug Information, Volume 30, number 4, 3, 2019, in Appendix 6, it talks about the good practice of national regulatory authorities in implementing the collaborative procedure for medical products, which is also a process that allows for reliance where the WHO works with member states. There's also the mutual recognition between country NMRAs, regardless the source or capacity or the maturity level. So here, they don't all have to, all the NMR they don't have to be on the same level, but then the weak and the strong work together for the betterment of the population to make sure that access to quality medicine is obtained across the region or globally. Can I please have slide 6, please?
Slide 6 is ready.
Thank you. So it continues to look beyond the national agencies. Now we look at under the anchoring on the African Medicine Regulatory Harmonization, which East Africa previously stressed much on. We realize that the regional bodies act as pillars. And today we are looking forward to creating the continental armor. So the regs, the harmonization procedures becomes very relevant. So for example, for the West African Medicine Regulatory Harmonization, this process has supported and created a good impression in the region to ensure that medicines are made available. So in as much as it has supported building the capacity of the NMRs, it has also built the regional processes. And these factors helped the processes to establish itself properly. In that case, we have the list of accepted reference NMR countries. For us, we are 15. We also provide guidances for the assessment which has been done. That also clarifies who is providing which documents and the reference NMR, which are the stringent or the stronger one, and then that was with again also the applicants, the confidentiality processes are also in agreement and done, believed in, where all the NMRs as well as the various experts, scientific experts, actually go into the process of agreeing that every step of the way is done confidentially. There's transparency, predictable, and faster approvals compared to the standard pathways to increase the effectiveness and attraction of its use, and then the opportunity in implementing regulatory reliance and also building trust within the NMRs. Slide 7, please. If we go through what was presented earlier, particularly the structure based on the WHO Reliance Working Document, we find that the normal standard, or which is the process that we know done at country level, is a decision made by individual reviews or inspections at country level. But as we move towards the reliance and work sharing and joint reviews that is merging now through the harmonization process, as well as mutual recognition, you realize that all the work has been expedited, where when there's one application at the regional platform, all the NMRAs are involved, they accept the assessment reports, and it moves straight to countries to receive market authorization. So this structure speaks well to the reliance processes in decision making across the countries on the region, and it will also definitely apply through to the AMA process. Next slide. So this efficiency-based reliance process is also looking at the steps and the movement from previous pathways to current developing pathways, in the sense that we want to increase access, efficiency, and then also improve on capacity. This has also been talked about, so I wouldn't stress too much on that. Next slide, slide 9, please. Now let's look at the perspective at the REX level, particularly under the West African process. The marriage harmonizing process was launched in February 2015, but its implementation actually commenced in April 2017. Here we have 15 member states in ECOWAS, 8 French, 5 English-speaking countries, and 2 Portuguese. So it's a mixture of culture. Yet we need to have a common understanding and agreement, and it has its own challenges in terms of language, interpretation, translation, and then an approach. So we have to actually gradually build that capacity with understanding and trust and transparency along the way for almost 2 to 3 years for us to be able to finally start the implementation in 2017. We have a steering committee of 15 member states and MRAs with stakeholders and then partners like the WHO, Bill and Melinda Gates, World Bank, Sweet Medics, many others, who are part of this decision-making and approval process when the procedure of assessment comes to an end. We also have 7 working groups, expert working groups who do the scientific reviews, GMP inspections, the information management system, the quality management system, the quality control, pharmacovigilance, and policy. And each of those groups are a mixture of the member states. In our region, we don't have a particular country that does only registration or only inspection. But we have, for each of the expert working group, we have a mixture of members from all the countries, mixed together. And each of them has 7 member states. And we've been able to work it out that for each of this working group, we find a member state within. So it brings that understanding and trust that we're all participating at one point or the other. And then they also a process of accountability and transparency along the way. You also have, these groups have developed all the documents, guidelines, each of the groups, and which are used across the region, both at the regional level, the same documents are also used at the national level. We also have a common technical document, and this same document, that is the procedure for registration of products, are used on the regional platform, and the same documents are also used at national level. So there is a synergy of work in terms of the harmonization process. So that process has a single process for certain selected medical products that were also agreed by the member states. And we find that about 10 criteria, so medicine, generics, biologicals, vaccines, medical devices, and other products that are all have been agreed. Next slide. Next slide, please. Now we look at the benefits. Is regulatory reliance of any benefit to us? I'll say yes. Because the benefits goes both to the regulator and then the pharmaceutical industry, as well as to the patient. It reduces the effort for both national regulatory authorities and the industry. It's also the applicants can use the reliance-based regulatory procedures instead of the standard. That also motivates the NMRs to enhance the regulatory capacities to maturity through the risk-based review systems, especially looking at the WHO global benchmarking tools, which most of the countries have moved through from different levels. And now we have the Ghana FDA as at maturity level 3. We have others pushing forward. So that reliance process helps the NMRs to push forward in terms of ensuring that they meet the criteria. So they make the mutual understanding and reliance process more, creates confidence, and it gives them that capacity to trust each other and know that whatever comes from one country is of good value and of good quality. They better manage resource capacities issues while simultaneously strengthening their regulatory systems. Also exploits the approaches to utilize concept of reliance and collaborative decision-making to increase timely access to safe, effective medical products. The result is a reduction of regulatory burden and offer an opportunity for faster and more predictable approvals. It also strengthens trust between stakeholders because the collaboration, the dialogue between all the stakeholders participating in the regulatory reliance activities help to create that trust and build that foundation of regulatory reliance. Next slide, please. Thank you. My recommendation would be that reliance between countries and across regional bodies is paramount. In that we're relying on recognized approval procedures and product dossiers, which particularly the example I've given, which is the harmonization process. And we can also rely on the good manufacturing practices reports from a jurisdiction where an applicant is located. The typical example between ECOWAS and EAC, we had a manufacturer from their region who applied in our region, and due to the COVID pandemic situation, we couldn't travel. So we had to rely on EAC for the GMP report and for the manufacturer itself, and even from the WHO to do a comparative assessment. So there was a desktop review and then there's remote virtual assessment. So reliance plays a key role to accelerate process because we would have stopped that process because we couldn't go to that country due to the COVID. But because there's that reliance and mutual recognition and acceptance, work went on all right without any limitation. There's also the mutual recognition between the countries within the sub-region itself, where you have Gambia, Ghana, and Sierra Leone, and NMRs accepting approved dossiers from Ghana, FDA. And then Sierra Leone also accepting from NAFDAC Nigeria. That we also have the French group, which is called the URIMOA countries, and among themselves accept dossiers within their own jurisdiction. And there's gain the advantage between Guinea-Bissau and Cape Verde because of the language, also accept dossiers. So Bissau from Cape Verde. So that also accelerates access to medicine. And if you look at the international bodies, because of the NMRs, because of the collaborative assessment procedure and the WHO, that reliance process is also possible. Next slide. In conclusion, I want to say that Regulatory reliance should be encouraged to strengthen regulatory systems and increase efficiency. Effective implementation benefits the patient, healthcare workers, regulatory authorities, and the industry. But then, guidelines with the purpose of accelerating the process has to be developed. And criteria for eligible products also established, and then expedited process also enshrined to ensure that all the certificates of GMPs that others have done can be shared. New products on diagnosis and prevention that other NMRs would not have had the opportunity to have assessed would have been exchanged. And then treatment of rare diseases that a country may not have knowledge or capacity to actually work on, would have received information from another jurisdiction to move on to approve those medicines so that the country would have access to. And an important part of health system performance and sustainability. Because through the process as well, we're able to generate resources because the industries gain access, they see the process being efficient, and they're ready to pay. And that alone will help every other at the regional level or at national level, the NMRA to gain resources to develop its capacity. So I want to say thank you for listening to me.